I teamed up with Lancaster Cancer Center to provide these nutrition videos called Dishes to Nourish. This month, we're going to talk about bowel changes during cancer treatment. Bowel changes are very common, whether you're dealing with constipation, where you're having trouble having a bowel movement for a couple days and you have hard stools, or on the opposite end, diarrhea, where maybe it's multiple loose stools in a 24-hour period or even longer. Both are not very pleasant to experience, but there are some things that you're able to do. Depending on the treatment that you are doing at this time, or if you're in remission, will change the approach to how to treat constipation and diarrhea. So please discuss this with your physician, or you can also discuss this with a dietitian or a nurse on staff as well. With constipation can be very uncomfortable, not being able to have a bowel movement for a couple days. If you are noticing that is happening, some things you can try are movement. You can try to go for a walk, try to get some stretching or exercise to get the bowels moving. Sometimes water is a huge factor, so making sure you're getting enough water in the day. Aiming for at least 8 cups, you may need more depending on your own individual needs, but making sure you're getting lots of water in the day. At times, if it's easier now that we're getting into winter months, to get some warm beverages in there too for the hydration, that works well as well. But those are 2 things you can do beyond nutrition. You can also start with foods that are high in fiber, so making sure you're getting enough of that insoluble fiber to help form the stool so that the water that you're drinking can help pass it is important. So things like fruits and vegetables with the skin on it. You can also do some whole grains or seeds or nuts to try to help form those stools as well. So a lot of times I will recommend flax seeds or chia seeds, hemp seeds, adding almonds or walnuts to your diet, or just increasing your overall fruit and vegetable intake. Now, fiber, if you are not having a lot in your day to begin with, maybe like 1 serving of vegetables or 1 serving of fruit, or not getting a lot of whole grains, I would start adding 1 serving at a time, gradually for maybe a couple days, and then adding another, just so your body can adjust to those changes. For women, usually the recommendation is about 25 grams of fiber a day. For men, it can be up to 38 grams. Again, it is good to talk to a provider to get your own individual needs calculated. So for diarrhea, this is a little different. So for diarrhea, usually we are concerned about your fluids as well, just because you are getting rid of a lot of fluid, getting rid of a lot of things from your body, so it increases your risk of dehydration. So you want to make sure that you are drinking lots of fluids, maybe even some electrolyte drinks that have some sodium, or they have some potassium or magnesium in them to help balance that out as well, since you are getting rid of all of that fluid, just to stay hydrated. Also, you can do alternative forms of liquids, like doing ice pops or jellos, just to kind of mix it up and make it a little bit more interesting to make sure you're getting your fluids met. Also too, instead of constipation, where you're going to increase the insoluble fiber, you want to focus more on soluble fiber. So those are ones that break down a little easier. So you probably have heard of doing bananas or white rice, maybe white bread during times of when you're having diarrhea. And that is just because it has more of that soluble fiber. It's a lower fiber food. Applesauce can be another great option, or canned fruit because it doesn't have the skin on it. Oats, those are great options that you can incorporate if you're struggling with diarrhea. Again, if you have any questions or concerns or want to talk about this further, please reach out to your provider or a registered dietitian to answer those questions. I hope you have a great day.